Hi, precious hearts. Thank you for joining me today, Stephanie, dental hygienist. In this video, I have the pleasure to show you my personal manual toothbrushing technique. I developed this technique years and years ago, bringing together everything that I learned, everything that I saw in my practices, everything that I knew from dental hygienist school. Have a seat and enjoy. First, feel good when you brush your teeth. Trust that what you are doing is right for your teeth, is right for your body. Be relaxed, be calm, enjoy. Just know that what you are doing is wonderful for you, wonderful for your body, and is getting you ready for an amazing rest. Why is important to relax? Because we have more room in our mouth. We were taught to open wide and look in a mirror to see what we are doing. If we are opening wide, the muscles that are on the side of the jaw, they are very tense. So we do not have room for a brush that has a size by itself. And as well, to move the brush, to do the proper strokes without damaging the gums and the teeth. In front is the same situation. For the bottom teeth, many times it's a recession on the front, or upper teeth, it's a recession on the front as well. So make sure you are relaxed. Another fact that is really helpful for you besides relaxation is to know that here at the base of the gum, so this side is called attached gingiva, but at the base of attached gingiva is a continuation with a soft mobile tissue that is forming and becomes the cheek on a side and becomes the lip on a front. So here at the bottom, everywhere along the jaw, we do have a mobile tissue. If we relax and we close a little bit our mouth, not completely, a little bit, like a finger goes in between the jaws, this area, if we use this mobile tissue, will be really helpful for all of us to have enough room. Even if jaw is very small, teeth are very big and very crowded, we can manage taking room from mobile area to brush properly everywhere in our mouth. Precious one, it's time to talk about how we choose a toothbrush. I will use my model. I do have here 3 situations that I'd like to show you. A recession, higher teeth at front, and a jaw that goes lower towards the left side, wisdom tooth at the back. For a recession, I will choose a brush that has longer bristles. The trimming at the end of the bristle and the different color is showing me that actually this brush is longer than a regular brush. I will position my brush below the recession and I will start brushing. In a demo video for toothbrushing, you will have more information. To brush here, actually, I can go sideways or I can go vertical. But because these teeth are higher, it's very hard for me to really reach here behind the last 2 teeth and brush away from behind the tongue, pushing the tongue away. So in this case, I would prefer maybe to have a brush that has a curved neck here between the handle and the head of the brush. This one is more straight. This one is definitely more curved, and it will allow me to really go here at the back. If still I do have a little bit of challenge, I will lift my hand as well. I'm not closer to the tooth, so I will lift my hand, and gives me more mobility to really go deep and brush. I will show you with this longer one as well. This Cura Prox, this one is a very compact and wide brush. It was designed much more for brushing circular. Please watch their videos if you'd like to check more about this brush. Look at their videos and see how you feel about this brush. On a shelf as last aspect will be brushing the last tooth. Look at this shape of the head is very thin towards the end. It will allow me really nicely to brush around the last molar. I will brush from the front back or from the back front, but never back and front, never. As well are some brushes like this Life brand name model that has longer bristles on the top of the brush. So these longer bristles are very useful to brush the back areas of the molars. A few brushes here have rubber bristles. The biggest is this model from Life. It will be the Oral-B, next one, with rubber on the side, and as well Colgate Sensitive Pro Relief 360 has rubber inside and as well rubber at the back of the brush. Using rubber bristles and as well impregnated bristles, this Colgate, I do not have anymore the packaging, but I believe is impregnated with activated charcoal. So impregnated bristles are okay when we travel on a plane. Sure, we can use them if we feel okay with them, but I would like for rubber bristles and impregnated bristles to make you aware, monitor sensitivity, monitor how you feel, make sure you brush very, very gentle and light, and you enjoy them. We can decontaminate a toothbrush by soaking the head of the brush, the entire bristles, in mouthwash, any mouthwash of your choice, 20-30 minutes every 2 weeks. As well, a toothbrush has to be changed when the tip of the bristles are starting to wear off, and when the bristles are scattered in all directions. As well, the third and maybe the most important tip that I can give you is when the bristles of the brush are very scattered, it means that for teeth is not very pleasurable the way we are brushing them. A brush that is looking damaged, it's clear that the way we brush the teeth is not very healthy for them. Brushing biting surfaces. Biting surfaces are these surfaces from the eye tooth at the back, premolars and molars. They have pits and fissures where buildup can hide, create acidity, and in time cavities. When I'm brushing this area, I will have a back and forth stroke and I will press to make sure the bristles are getting into the pits and fissures, cleaning very, very well. The stroke actually will be not only straight on the surface, but I will try to angle slowly the brush in one direction and then in the other direction to cover the corners, the margins of the teeth as well, the front margin and the back margin of the teeth. When I'm doing this, if you observe, by angulating towards the front, towards the cheek in this area, I will brush as well the vertical face of the teeth, at least half of it. This is a small tooth. If I will have bigger teeth, it will be about half of the height of the face on this specific tooth. This is important to mention because with my personal toothbrushing technique, I will show you how to brush properly the gum area, not much here on top towards the biting surfaces, but much more the gum area and up about half of the height of the size of the tooth. Something that I would like to mention, by brushing back and forth on occlusal surfaces, very soon the bristles of the brush will go scattered, will go in all directions. So this brush is not good to be used when we brush gums and the vertical part of the teeth. It can damage these areas. So I strongly suggest when we use a manual brush to have two brushes, one for biting surfaces and that can be soft or extra soft, and the sensitive one, extra gentle one for areas that are gentle, gums, and the vertical area of the teeth. We arrived at the most exciting part of this entire video, my personal toothbrushing technique with manual brush. This technique was inspired by the way we broom floor, by brooming technique. Let's say this is our broom, this is our floor. When I broom, I will position the broom about 45 degrees and I'm going in one direction, collecting the dirt and guiding the dirt towards a designated area. As well, I can do a bigger stroke or I can do shorter strokes when I broom. I can press a little bit, not too much. I can get stuck with the broom, but I can press a little bit sometimes if I need. In On a floor, I will never broom back and forth. I will never broom circular. I will never broom rotating the broom. I will never broom pushing against the floor. In a mouth, we do brush back and forth. We do brush circular, sometimes bigger stroke, sometimes smaller strokes, like very damaging for in between the teeth. We can rotate the brush using wrist or using fingers. And some of us, not many, but some of us have a way of brushing by pushing the bristles of the brush in between the teeth. In a proper brushing technique, I'm aiming to squeeze the dirt, the buildup from under the gum up. So what I would like to do in this receded area, I will position the brush 45 degrees way below the gum line of the receded area. So I'm positioning way below and I'm coming up. I can press a little bit because I do not go against the tissue causing trauma. Actually, I give a stimulus for the tissue to grow, to nurture, to cover the tooth, to protect the tooth. It's like a massage that you give to your gums. Now, through cell division that happens regular in 4-6 months, if you stop traumatizing the gums, you can observe a rearrangement of the gum line. So cells in a gum, they do not grow like a tumor, but they shed off regular old cells and are replacing them with new cells. All these cells, they have a memory and they really know their happy place. They really know what makes them happy. And they know where they should be to be healthy and happy and really okay. So just trust the process, because it won't happen for this case of a recession of about this one can be 6 millimeters, even more. A recession like this, first, you won't notice this inflammation that you see here on this model. So inflammation will be subsided, and the alignment, the new alignment of the gum line can gain 1-2 millimeters of perfect seal, perfect attachment to the bone that is exposed. And 2 millimeters and no inflammation here, believe me, it's a very happy place where someone can be. Just to show you more, I'm going here at the back. So I will open my mouth, I'm introducing the brush, then I will come on a side, pulling the cheek. In this moment, I will close slightly. So from here, I will close slightly, and I will position the brush 45 degrees into the gum. And I'm coming up. I'm just coming up. Now I will keep the brush here and show you where I am. I'm here. So believe me, even if you don't have too much space in here, just trust that you are doing a very good job, because through brushing, biting surfaces, and please check the part of the video where I'm showing you how to brush biting surfaces. You will brush in this moment when you angle like this, half of the height of the crown, it's brushed. And then I'm coming with a shorter stroke here from the bottom up, and I will brush the other half of the height of the crown. So you will have a complete brushing of the tooth. Here at the back where is the most challenging, actually, because of lack of space. So I will show you again. I will try just to short strokes. You can press, but make sure it's 45 degrees. At the back is exactly how I showed you. So I'm not parallel, I'm not perpendicular. I am 45 degrees, not parallel, not perpendicular, 45, and I'm coming up. As I showed you, where I talked about choosing the toothbrush. On a front area, actually outside the tooth, you can brush easy. You don't have to come out of the lip. You just position the brush and you just go, keeping the brush inside the mouth. You can go actually everywhere. At the back here, if your brush doesn't fit horizontal or is not comfortable for you horizontal, you can definitely go. I will take a white brush, maybe you see better. You can go in a vertical stroke, but in this case you can splash the mirror that is above the sink. So maybe you'd like to stay forward in a way in which you splash into the sink instead of splashing toothpaste towards the mirror. In the same way you can do it here. So if you observed brush, I'm using one side and now I'm using the other side of the brush. My brush stays compact. Bristles will be compact, well maintained in time. That's why I'm asking you to use two toothbrushes when you brush. One for the gums and one for the biting areas, just because we have two different, completely different strokes and different areas that we have to brush. Bone, and this one is a combination bone with very gentle tissue. So when I'm brushing bottom teeth, bristles, they face bottom teeth. Like I'm brooming the floor, bristles face the floor. Now I broom the ceiling, bristles face the ceiling, or I broom upper teeth, bristles face the upper teeth. I will position into the gum surface 45 degrees and coming down. Coming down. Inside, it will be very difficult when you start to do this. Inside, 45 is a very weird stroke. We are not very used to use this type of movements with our hands. We are doing much more office work. So it's not very comfortable at first. Strokes can be very weird. I do have a recommendation here. Start with a small area. Let's pick bottom half of the jaw. Try to do it front of teeth and back of the teeth, maybe for 1 week, 2 weeks. When you feel comfortable, go to another area and develop a new stereotype. Front teeth, back teeth, and later you move for the upper jaw. You can divide upper jaw in 2 parts as well. And take your time. Do not judge the process. Trust. Feel good. And believe me, the body will do the rest. If you stop traumatizing, going against, the body will do the rest. We are at the end of the video. I'm complete. Thank you so much for having so much patience to watch till the end. It's my pleasure to help. It's my pleasure to serve. Please take what resonates with you and discard what doesn't make sense for you. And enjoy a wonderful, wonderful life. Be healthy, be happy, and look forward for wonderful, wonderful miracles in your life. Thank you.